All right, so I'm going to go over some medications that increase the risk for suicidality. I think that this is important because I counsel a lot of patients and they're unaware of the risks of the medications that they're taking. And I think it's very important to know if you're on a medication that can increase the risk of suicidal ideation or suicidality behaviors like that. So first, all antidepressants were issued a warning of suicidal behaviors. This is mostly for adolescents and young adults. So it's not just your SSRIs and SNRIs like your Prozac and your Prestique. It also includes medications like bupropion, trazodone, mirtazapine, and amitriptyline. So amitriptyline is in the class of tricyclic antidepressants, TCAs. And we used to use those medications more often. But because of their side effect profile and the fact that it doesn't require a lot of it to be lethal is that we don't use it anymore. So only about a month or two supply is enough to kill someone of amitriptyline depending on the dose. So we don't use that too often anymore. Another medication that has literature showing suicidality is Chantix or varenicline. Chantix brand was withdrawn off the market due to an impurity, but the generic is readily available. There's side effects of mood changes in some people and abnormal dreams, so that's something to go over with a patient. It's the only medication on the market like it actually, which is a nicotinic receptor agonist, so acts on nicotine receptors. Another medication that not a lot of people know has mood changes, agitation, hostility, aggression, and suicidality is montelukast, or Singulair. It's used for asthma or allergies sometimes, but that's something that's always a shock to people. The neuropsychiatric events that can come with it sometimes, so it's very important to know. We don't have a mechanism for that, given how it works mechanistically. Another medication is gabapentin that I've mentioned in one of my other videos for post-herpetic neuralgia, and then I believe partial seizures, and sometimes some off-label uses like anxiety. It's used a lot for animals. Another medication is Daliresp for roflumilast. It's sometimes used for severe COPD to decrease the risk for exacerbations. Some antipsychotics too have literature showing increased risk of suicidality, like Abilify, Seroquel, Rexulti, Latuda, Vraylar, and Zyprexa are some examples. Some AEDs or seizure medications for epilepsy carry the risk for suicidality, like Keppra and Briviact, or brivaracetam and levetiracetam. I did have a patient who was switched from levetiracetam or Keppra to Briviact, actually, due to the aggression. And I had a discussion with the resident, the provider who was switching them, and I was like, okay, well, they're in the same drug class. I'm going to assume that they're going to have the same response to brivaracetam that they had to levetiracetam. So I had a discussion with the provider on that. Another medication is carbamazepine. It's used for seizures sometimes for bipolar, and then trigeminal neuralgia as well. And then another anti-epileptic drug is Banzel or rufinamide that has some literature showing suicidality. Another medication is efavirenz. I mentioned it in my hallucination video, I believe. It's an older HIV med. It's in the combo drug Atripla. And then it has up to a 10% incidence of depression as well in patients. And then lastly, I'm going to mention a drug that causes homicidal ideation, which is interesting. It's called Fycompa. It's a Schedule III controlled substance, and it's for seizure disorders, certain types of seizures. But it causes some aggression and hostility in some patients.